You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, 6-month smile, 6-month braces. It is a new way for people that maybe are considering veneers, Invisalign, but want to save a lot of money and get the same results in most cases. And with us, we have an expert on the topic, Dr. Kim. Dr. Kim, welcome to the program.
Thank you very much.
Okay, so with 6-month braces, okay, so you went through a certification course to do it, and you're saying this is not to replace orthodontics.
No.
It's different.
It's very different.
How so?
Traditional orthodontic treatment is an ideal situation where you're trying to alter or change, improve patients' bite issues. They're having any back tooth problems, chewing problems, things of that nature. But short-term orthodontics, like the 6-month, is just cosmetically altering the teeth that are in your smile lines and not altering your bite.
So only the teeth that show.
That show.
Okay. Mm-hmm. And is it really 6 months? Could it be more? Could it be less?
On average, it falls in 6 months. It's 6 months. Sometimes it could be 9 months, but most of the majority of the patients fall in 6 months.
Okay, in tough economic times. Okay, you know, the reason I think this is a hot topic, and when we heard about it, you know, we went to the website. We said, you know, we want to talk to a few doctors about this.
Sure.
It's a lot less, like 90% less than veneers to straighten 16 teeth.
Yes.
I mean, nothing against veneers, but this is a lot less.
A lot less. No, veneers are still very acceptable in certain cases, you know, but in patients who are unhappy with their crooked teeth, spaces, overlap teeth, and things of that nature, short-term orthodontics is a wonderful way to get a quick, very predictable, conservative approach to get that smile.
And you like it?
I love it.
So getting into the categories then, I mean, who's the ideal candidate for 6-month braces?
Well, it could range from patients who've had braces before and the teeth are now shifting and they just want a quick refinement of their teeth, straighten back into position. Patients who've never had braces and they've always wanted straighter teeth. Anyone who finds themselves self-conscious about their smile, they're not smiling or very uncomfortable smiling in public. Patients who work in public places and they want to have a boost of confidence in their smile.
Do you see changes, by the way? You straighten their teeth and changes in their personality?
Sure.
Like what?
You know, we have patients who come in, start the procedure, and after the procedure, it's not all very dramatic at once, but next time they come in, they're a little more social. They're smiling a little more. They're working out a little more.
Really?
Yes. The hairstyles changing, colors change, things of that nature.
How important is the smile?
I
Seems like an obvious one, but...
Yes. I mean, the smile is a window to your soul, I believe.
Okay.
Yes. It makes great first impressions, your self-confidence, how people see you, they're perceptive of you. And so in this society, I think it's very important.
You brought some photos.
Yes.
And I should tell you, if you're tuning into this, because I'm always skeptical. I say, you know, it's a dentist, of course, but these are dramatic photos. I mean, it's interesting, actually, the difference by just changing the smile, by just straightening the teeth.
Just one simple thing.
Okay, let's take a look. What do you have for us?
And so, first patient right here that we have, and what you're seeing right now is what's very typical smile that we see in our dental offices, and it's a very common complaint when patients come in. Rotated teeth, crooked teeth, spaces, teeth are not aligned correctly.
Those two outside teeth are way up there.
Way up there. The canines are way
Is that common though, to see that kind of a thing?
Very common. And the reason you might not see is these are the typical patients who do not smile at all.
They don't smile.
Mm-hmm. And maybe misunderstood as being antisocial.
Okay, okay.
And if you look at the after pictures now, this young lady over here, this was done in 7 months.
Very nice.
Very nice. Teeth are where it's supposed to be. The teeth are brighter. The smile is broader. The corners of her mouth are actually showing all of her back teeth and giving her the ideal smile.